value of health is known only if we fall ill. Good evening, dear friends. Welcome to a brand new episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. I am Jasila Mujib. Today we will be discussing about the effect of diabetes on hearing loss. And the doctor joining us today is Dr. Muhammed Ahsan from AlHilal Hospital, Adaliya. He is a specialist ENT surgeon with an experience of more than 10 years. So, doctor, welcome to the show.
Thank you. Good evening.
Good evening, doctor. So, we will be discussing about hearing loss and
diabetes.
diabetes.
So, the incidence of hearing loss is around 30% in pre-diabetic patients when compared to a normal population. And it will be twice, like around more than 50% in patients with diabetes when compared to the normal population. And whereas the balancing issue, it will be around 70% when compared with the normal population. And that's the problem with the diabetes. It can affect any small organs when it is for a long standing period or a chronic, it goes to a chronic stage.
Okay. So, doctor, what are the causes of hearing loss in diabetic patients?
Diabetes, if it is a long standing one, a chronic stage or uncontrollable diabetes can damage the inner ear structures, or it can affect the microcirculation of the blood to the nerve which supplies the nerve like the inner ear to the brain, or it can affect the blood circulation to the area of the brain which dealing with the hearing also. So that's the main thing with the hearing loss and the balancing issue in diabetes.
So, doctor, what are the risk factors associated with hearing loss in diabetic patients?
So, dealing with the risk factors, one of the main things is the control of sugars. If it is in a higher state, it can affect the smaller nerves, as I said before. The next one is the increasing age. When the age advances, it can affect the hearing again. Another one is the genetics. Some hearing loss can run in families also. Another one is the some certain infections like measles, mumps, meningitis, or certain conditions like stroke or multiple sclerosis which affects the brain. And the other risk factors include exposure to loud or continuous exposure to loud sounds, those who are working in loud noise industries or those who are listening to loud musics regularly, that can affect the hearing also. And certain chemicals and certain even drugs can affect the hearing, like certain painkillers, antibiotics, and diuretics, which are used in normal population. These are like ototoxic, we call. It's like not good for the ear. So such things can affect the hearing.
Doctor, now can you explain about the common symptoms of hearing loss, especially in diabetic patients?
Okay. Coming on to the symptoms, the patients usually frequently ask the other persons to repeat their conversation if they cannot hear, or they will have problem with the conversation in people who talk very quietly, or when talking to women or children also, or they'll face difficulty when talking in a loud noise environment like a busy restaurant or crowded places, or if there are too many people around them, and they'll be having difficulty in hearing the normal common daily sounds like a telephone bell, alarm clocks, or doorbell. Those things are frequently noticed in people with the hearing loss.
Okay. So, how can we diagnose the hearing loss? Are there any tests especially for this?
Yeah, we have tests. First of all, when they come to our clinic, we'll have a proper ear, nose and throat examination to see if there is any outside problem like a wax or something. If there is no wax or something, we'll do some clinical test like a tuning fork test to know what kind of problem they are having. So if we suspect a hearing loss, we'll send them to further evaluation. First one we do is the audiogram test. It's a test to see, know what type of hearing loss it is and the type and degree of hearing loss. So the patient will be put in a soundproof room, and they will be given some frequency adjusted sounds like beeping sounds. It will be given, and we'll chart out the hearing pattern in that thing. And the next one is the speech testing also. So we'll give some certain words to the patient, and they have to repeat those words. Based on that, we'll consider the score of the hearing in that thing. And the other one is the pressure testing. to see if there is any other problem with the hearing, like fluid buildup behind the ear. These are the main things we do for the hearing test, and there are other sophisticated tests also, like auditory brain stem response, otoacoustic emissions. Those we don't do regularly, but it can be done also.
So once diagnosed with this hearing loss, what are the treatment options?
Treating these patients with diabetes, the first thing is control of the sugars. So always the sugars should be controlled on a regular basis. The only thing is if the sugar is controlled, we can reduce the progression of the disease, but we can't reverse what has happened already. Like we can't reverse what has happened already. So that is the main thing in sugar controlling. And the next thing is hearing loss treatment is aimed at patient make them able to communicate with others. Like for that, main thing we use is the digital hearing aids. So it's like a small electronic machine which can be kept around the ear. It may be outside one or inside one. Based on the size also, it is the multiple options are there. It's just nothing but it's like an amplifier which amplify the sound what we hear, and they'll be able to hear better. But that also, it's based on the degree of hearing loss we provide it. If it is a mild and mild category, usually we don't ask them to use it. If it is more than that, like a moderate or severe problem only, we ask them to use the hearing aids. The other things, if there is a severe hearing loss, they can use lip reading or sign languages, or if they are affordable, they can go for the cochlear implant surgery or auditory brainstem implant surgeries also.
So what type of treatment you suggest for elder people?
Elder people, that's it. If they are willing to buy an hearing aid, we advise first a hearing aid trial first, so that they can see whether it is like they can adjust with the hearing. If they are with the trial, if they are okay, we ask them to buy a new one. Okay, it's mainly digital hearing aids is the main treatment option, because in here diabetes, the main problem is a nerve problem, which is an irreversible problem. So only option left is hearing aid. Okay.
Now, doctor, what is your message for our viewers who are diabetic and having hearing loss?
Okay, that's a good question. Hearing loss, it should be like yearly screening should be done, as we do for eye checkup in diabetes patients. They do regular eye checkup. Similarly, they should have a regular annual screening of the hearing also, and they should avoid using anything sharp like sharp sticks, pencils, tweezers, or paper clips to clean the ears. And always those who diabetic patients, when they are working in a loud noise environment, they should use ear protection devices to reduce the further damage of the hearing. These are the main things they should keep in mind.
And finally, doctor, what do you have to say about AL-HILAL Healthcare? What are the services you offer at AL-HILAL?
AL-HILAL Healthcare is the leading and the fastest growing healthcare group in the Kingdom of Bahrain, and we do provide all kind of treatment facility in our AlHilal branch also. And we treat as a team for the diabetic patients, especially from the GP, internal medicine, ophthalmologist, otolaryngologist. We treat them as a team together. And I am available in AlHilal AlHilal branch in all days from 3 to 11, and Friday is my weekly off.
Okay, thank you, doctor.
Thank you.
So viewers, I hope this was a very informative episode. For more informative episodes, tune in to BMC Global Live AlHilal Health World every Tuesdays at 8 p.m. Till we meet again next time with a special episode. This is Jessila Mujib signing off. Good night.